You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. We're talking about dental implants today. With us, we have Colorado's go-to implant dentist, Dr. Daniel Briskie. Dr. Briskie, welcome to the program.
Hey, thanks a lot, Randy.
Good. Now, I know you brought some photos. We'll get to as many of those as possible. You said you had a stack, but I told you to just bring like 8 or 10. So, so we'll get to the. For people that don't know your practice, like who's the typical dental implant patient?
Typical dental implant patient. I'd say we usually have around 2 different types of patients in our practice.
Okay.
One that currently wears dentures and they're thinking, like, what do I do? There's no hope. So those denture patients, what they do is they give us a call. We get them in the same day. Or one of our slogans is call today, get seen today, right?
Okay.
We want to help you out.
All right.
So you come in, we're going to have a nice conversation about what to do, what your options are, right? The biggest thing is people don't know what their options are, right?
Right.
They think that there's no hope, but there's a ton of hope. I have lots of options. So come on in, we'll sit down, we'll go through all of your options together, right? And in as little as 3 days, we can actually have a permanent set of teeth.
Upper and lower.
Upper and lower.
So when you say a denture wearer, we're talking on the phone, can walk in the day of the procedure, no teeth, walk out with upper and lower teeth that don't come out.
Yeah.
Is that rare, or that's?
That's very common, Randy. Yeah. Very common, all the time. So for those people, if we can't save their teeth, what we do is we take some digital scans, right? Some photos. We ask you about what your teeth you want them to look like. The cool part is we're going to do all of that work in-house. In as little as 3 days, you're going to have a brand new smile. Upper, lower teeth, permanent.
Okay. So if you have bad gums, you could still do this. Like somebody with really broken down teeth. The implants aren't more likely to fall out or have an issue?
No, not at all. All the people that actually have implants currently do have bad gums, right?
That's why they're coming in.
Or they're coming in, yeah. Or they're missing their teeth. So this is extremely common. Right.
All the time.
All the time.
And so is it more men than women or more women than men? Because men put things off, right?
Yeah.
To the last second.
Yep. What we usually see is for example, like a couple that comes in, right? The husband and the wife. The wife little sits in the corner, brings the husband in, sits him in the chair, experiments, right? Lets the husband go first, right? Then as soon as he has a fantastic experience, she comes in right next because she's smart. So I just had a couple come in. Husband and wife, they're in the middle of their 50s.
Okay.
They came in, they randomly, they both actually had a few implants placed, like one here, one here, one here. Their smile didn't look good, right? Their gums are still bleeding.
Okay.
It didn't get them anywhere. So the wife sat the husband in the chair first.
Okay.
And she goes, what can you do for him, right? But she's sitting very, very quiet in the corner, very reserved. But then at the end of the discussion, all it takes is some listening. So we sit down, like, no, I don't want to use her name, but I wish I could.
Yeah.
But he's like, what do you want to get out of this? Or what are your options? At the end of the day, it doesn't matter what option you pick to me. What matters is that you know what your options are.
Okay.
Right? And you know that what I can do for you is within the next 3 days to a week, right? You can have a permanent set of teeth. And
so
that's
that husband
exciting.
and wife, he was headed for a denture.
Yep.
And he got upper and lower teeth supported by
He did.
implants.
They actually got them a day apart from each other, which is really cool.
Oh, that's nice.
Yep. The husband went first, of course, right? Then the next day she had her surgery as well, so they got to heal together. I have a saying I like to say, it's those who get implants together stay together. So,
that's good. That's good.
Yeah.
And I know you and Dr. Dude have a sense of humor about the whole thing.
Yeah.
You guys have some fun in the practice.
Yeah. Life's too short to be way too serious, right? I'm very of an introverted person. I usually a little bit more nervous on camera. I'm just a little bit more informal. So
okay, good.
I treat people like my family. I talk like this during my entire day, the staff, patients, same thing.
Okay, good. Now, at your office, I guess you guys have a unique setup, right?
Yeah.
Because I guess how implants, and correct me if I'm wrong, are typically done, you go to one place to get the surgery, maybe somewhere else for the imaging center, and then another place where they put the teeth on top. You guys do it all right there.
We have
and you have a lab.
Yeah, we have this reaction. All the patients think this. So they come in and they're used to going to the dentist down the street, and then they go to the oral surgeon, right? Then they go to the prosthodontist, and they all have their treatment plans. Like, well, this person charges this person charges this, right? They go on a tour around the entire city when they could literally just come see me, right? We sit down, I do the surgery, I plan the smile, I do the lab work, right? I own a lab in the building. I don't know any other offices in Northern Colorado that own a lab in their building.
Is that why what takes other guys like 10 months, as you say, you can do it a few visits?
Yeah, exactly. Yeah. 1, 2, 3 visits. Like that's literally all it takes, which is really cool. And it's so unique that all the amount of training that I had to do, right, in my career to get to this point where I can sit a patient down, diagnose, I can say, hey, this is what you need, right? I know exactly what you need because we've done this 1,000 times.
Okay.
Right? Then we can plan you for your surgery. I do the surgery, right? We put you to sleep. You don't have to be awake for this procedure. And you wake up.
Sedation?
IV sedation, yeah. So 100% asleep for those. So technically they're not asleep, right? But they're sedated.
And you're monitoring what?
We're monitoring their health, their vitals, right? I want to make sure they're very comfortable. So 2 things you have to watch out for is we need monitoring their health, and I want to be focusing on the dental. I want to be focusing on doing an amazing surgery for my patient.
Now, you look like a young guy. Yeah. I know your age. You look 10 years younger than your age.
Thank you.
But you teach dentists across the country. I mean, you have a training center.
Yep.
Training program where you teach dentists dental implants.
Yeah.
Is that right?
That's correct.
Okay.
Yep. So we had actually just the newest thing that just happened is I became faculty on a network of dentists called Dental Success Network.
Okay.
It's about 2,000 dentists, and I'm faculty for surgery and implants on it. And of course, I'm always the youngest guy in the room too.
Okay.
Right?
Okay.
So it's a little overwhelming for people sometimes, but it's fun. We teach. So we have our own courses at our building currently.
That's nice.
Yeah.
They fly in and go learn implants.
We usually have around 10 to 14 doctors come in and they learn the surgery. Either they do the surgery and I watch, or I help them through the surgery, or I do the surgery myself and they can pick up tips along the way. I also will go travel to office and around Colorado. Yep, I'll drive out and we'll find a clinic that the doc needs some help. Or the doctor, the biggest complaint is the doctor says, I'm sick of sending my patient to the oral surgeon, the prosthodontist, and all these other people, right? Like, why can't I help my patient in my own office? My patients don't want to leave, right? So they'll
it
have
makes
me come
sense.
out.
People don't like going to the dentist, right?
No,
Anyway,
yeah.
So to do it in one shot would be probably
exactly
better. So somebody watching this today, they have no teeth.
Yep.
And let's say this is on a Monday. Friday they have their new teeth.
Yep.
Is that possible?
Yeah, 100%. We do that all the time.
And now what if they need extractions, like really bad teeth, extractions, bad gums, same thing? They could still do it, like come in on a Monday, get it done?
Oh yeah, it's actually easier that way, right?
Really?
Yeah, if there's some more mobile teeth, a little bit more gum issues, it means you have more bone loss. It's actually easier, quicker for me to take the teeth out and put implants in.
Is that right?
Yep.
How old can you be to get this procedure?
So
what's your oldest patient?
My oldest patient right now is 89. He just turned, his birthday's coming up 90. I actually just saw him. He has a set of snap-in teeth. He has 5 implants, and we did a set of permanent snap-in teeth for him.
Why would an 89-year-old want to do this, though?
Mostly for, as we age, like a big part of our lives is actually just social, right? Like you and me sitting here and having a conversation, right? Imagine being with your family or some of your friends at the age of 89 and you can't eat well, right? If you can't eat like nuts or corn on the cob or like a chicken wing, right? Like a chicken wing sounds good, or a good piece of steak, and you can't eat those things. It's very restrictive.
So age doesn't matter?
Age doesn't matter.
I mean, so 89. So do you ever hear this? Like 80-year-olds that say, I'm a bit too old for this?
They say it all the time. Actually, the most common is, we have 60-year-olds saying, hey, I'm way too old for this. So like, no, you're not, because I have an 89-year-old in my chair currently doing the surgery.
So what do they like more? Do they like what they could eat with their new teeth, or do they like just the way it looks?
It's usually one or the other. When they come in for a consult, they say, hey doc, I don't care about the smile, I just want to eat well, right?
Okay.
Or because they also think that it might be a little bit cheaper too, right? Okay. Or it's, I want this to look beautiful, I also want to start smiling really well, and I don't really care how things are going to chew that well, right? Because I just want them to look good again. But the cool part is they tie together so closely, right? So if I build you a smile that looks nice, I'm actually going to make sure that you function well, right? I care about both. So
the way you could eat and all that.
Yes, it's very, very extremely important. One comes with the other every single time. So
do they eat better, or do they gain weight? Like people that weren't able to eat before.
Yeah, they actually gain a little weight too, so you got to be careful. Right? You got to eat all these foods you haven't eaten in such a long period of time.
So the most expensive part of this whole thing is all the going out to eat at restaurants.
It's all the dinners. So you got to make sure you're not ordering the filet mignon every time you go out, right?
Yeah. Okay, you brought some photos.
Yeah.
What are we looking at?
Yep. Nathan.
All right.
This guy, he went to a holistic dentist for about 20 years, right? He's had bleeding gums for 15 years, 15, 20 years. His teeth are getting mobile. Everything's starting to hurt, right? He actually saw us through a friend that recommended him.
Okay.
He came up, he's like, Doc, I don't know what to do, right? Like, please tell me, like, what do I do? How do I save my teeth? And he couldn't save his teeth, right? No one actually told him that. No one gave him the options of some replacement options for getting implants.
So his option would have been a denture.
His option would have been a denture, and the holistic dentist actually, I mean, we kind of dragged him along a little too far, right? Where he has all this infection for such a long period of time, and it felt bad, but his options were, you could have a denture, and Nathan was not okay with wearing a denture.
Okay.
So he started to look for other options, and the options are dental implants, right?
Okay.
Now, here's a picture of Nathan, even just in his temporaries. So he came in,
looks good.
he did his top, and then he was so happy he actually did his bottom about 2 months later. So a complete set of new teeth, top and bottom.
So remove the teeth.
Yep.
Clear up what? The gum
remove
infection?
all the infection. And the cool part is he feels so much better now, right? He doesn't have all the infection. His job is he actually sells vitamins and supplements.
Okay.
So this is actually one of the most healthy guys you'll ever meet.
Okay.
But he didn't know what was going on in his mouth, right? Which is crazy.
Yeah.
So all this going on, told us we're gonna wear a denture, just didn't accept it. And he went out, and thank God he found us.
So how soon could they eat?
Very soon. So that next day is what we usually recommend
All right.
it. Start off with a little bit of soft foods, right? And as soon as you get a hang of how you're chewing again, you can start eating anything you'd like.
Like, could you bite like a raw carrot with your front teeth, or you got to be careful with things like that?
Raw carrot like that is a little scary, right? But of course, you can bite into like corn on the cob, apples, things like that.
Okay, so anything you'd want to do with your regular teeth, you could do with these.
100%.
And they can last as long as you take
Oh
care of
yeah,
them.
if you take care of these implants, they're gonna last a lifetime.
Is this like the newest trend in dentistry? Like, let's say 20, 40, 50 years from now, dentures as we know them won't exist. I mean, do you think they'll all be attached to something?
I sure hope that in 20 years, no one knows what a denture is. That should have happened 20 years ago.
Okay,
Yeah.
okay.
So this next patient,
All right.
This is one of the biggest turnarounds here. Now she comes in, she has one of the biggest personalities. She's so friendly, smiles all the time, but she actually has a flipper that comes out, right? She's removing it. She's actually trying to fit it back in as she's talking to me. So one of the strongest personalities ever. And I was
Okay.
like, when we were doing her consultation, I told her, I was like, I want to do your case.
Okay,
You're going to
okay.
look fantastic after. Please let me do your case. So with the partial, since it wasn't fitting well, right? Her teeth started moving around. Her top teeth started to flare. Her bottom teeth started to move. And she was actually at risk of losing her bottom teeth as well.
Okay.
So what was really cool is she got it done very fast. She got hers done within a week, actually.
All right.
So she came in, I took out all the top teeth. We gave her a brand new set of teeth, which was amazing. I placed 2 single implants in the bottom, and now her completely...
Let's take a look.
Yep.
So she's way too young to be wearing a denture.
Nobody should be wearing a denture, Randy.
Okay, good point, good point.
yeah.
But it's, no, it looks good.
Yeah, it fits her face. It looks so nice. So just look at the before and after of this.
All right.
You can even, one of the telesales that I'd like to look at is just the eyes. When you look at the eyes on the before and after picture, you can just see that, like the squinting a little bit, like the happiness.
Okay.
Right? You can see her hair's done. We have some eyeshadow on. We got that big smile. You can see those like dimples more as well, right? So this is a complete turnaround. This looks fantastic.
You know, and like you've explained in the past, that a smile is more attractive than a frown.
Right.
So it adds to somebody's attractiveness.
Smiles are contagious. They really are.
Okay.
I guarantee she's making other people smile now too. Here is another patient.
All right.
Brenda. So she has an existing denture on the top. As you notice in the picture, she's not wearing it, right? It's actually at home. That's
So
how.
there are people with dentures that don't even wear them.
Yeah, most of them.
Really? Okay.
Yep, most of them. So she came in. She had always been told that she doesn't have enough bone for implants recently, so that's just very scary, right? But she actually does. And when 10, 15 years later of wearing a denture, what happens is the bone will shrink, okay? And you get to this point where it's hard to find someone that actually knows how to place those types of implants.
Okay.
Because at our practice, we can actually place some special implants in areas where patients don't have much bone.
Yeah, but what if you've been wearing a denture 20 years? You can't do this because you don't have enough bone.
Not true.
Not true.
You can 100% do this.
Okay. Is this one of the things you teach when you're teaching other dentists?
Yes, exactly.
Okay.
Yep. Here is an after one. This one was almost 2 weeks after. You can see her eyes are a little bit closed. It's because her eyes had so many tears in them. So she was just so happy. And you can see that big, big smile. Randy, just look at the before and after. Would you say that she's more attractive now?
No doubt about it.
Yeah, she's making me smile. Smiles are contagious.
Okay. So how, as far as the design, like the shade and, you say men have different smiles than women.
Yep.
How do they get to see what it's going to look like beforehand? Do you give them any sort of imaging, or what do you do?
We do, yeah. We actually do what's called a smile design. So we encourage them to pick out the color, the shape of their teeth, right? Even photos from when they were much younger. We take all these things into effect. And the cool part is, even if you get your permanent set of teeth, right, in 3 months, or actually as little as 6 to 8 weeks, we remake them for you at no charge. And at that time period, a lot of patients say, hey doc, I kind of want this one tooth tilted a little bit over here, or I wanted a half shade brighter, but you get the pick.
So when she looks in the mirror, because that is a dramatic, I'm not trying to side with you, by the way. I think anybody watching this knows, because she looks a lot younger.
Yes.
Right? What do when they see themselves for the first time and they're not sedated, do they get choked up?
Yeah, she did. She sat up and she was a little bit, sedated still during her appointment, but I handed her the mirror and she just immediately started crying.
Do you guys ever get choked up?
Yeah, of course. Usually what I'll do is I'll excuse myself for the room for a few minutes just because I don't want my staff seeing me.
Okay.
I can't show that, right?
That's nice. Yeah. That's nice. That's nice. Time for a few more.
Yep. So this one we have Nikki.
Okay.
Now, when we're looking at the teeth, what I see and what you should see looking at it is the teeth are very short. You can see that the edges are gone, right? And it has like a curve to it. So we're missing so much of the tooth now.
Okay.
Right?
Okay.
So she came in, she's missing several teeth. The teeth are ground down, and she just wasn't happy. So she was told that she needed a denture from her last dentist. Okay. She's not having that. So she heard about us.
That's why they go to you.
Exactly.
Okay.
Yep. Here is an after. And what you can see is the smile just fits her face much better. Wouldn't you say that she looks happy?
Yes.
Right there?
Yes.
Yeah, she looks happy. You can even see most people smile with their eyes, right? So you can see she's just much more happy.
And these look like porcelain veneers.
Yeah.
But they're made out of a much stronger material?
Much stronger material. So what we usually do is we'll make them out of zirconia. Zirconia is, by definition, artificial diamond, right? It's very strong material. It's very translucent. It looks very pretty, right? It mimics enamel and real teeth.
So they can eat salads, whatever.
Yep, anything.
This is another younger person that would have been wearing a denture, you're saying.
Exactly, another one.
Now you're a dentist. You probably think that the smile is like the most important thing. How important is it in your view?
It's not because I'm a dentist, Randy.
Okay.
A smile is so contagious, right? It's the first thing we see to someone. Let's say you hop on a plane, right, for a vacation.
Yeah.
You land in a different country, and what you're looking for is people that are smiling, right? Some people that are warm and welcoming.
That's good.
Right?
Good point.
People who are just generally happy. People that I want to be around, right?
Now you say people with bad teeth are judged.
Mm-hmm. They are judged. They're judged unfairly, right? People think that because you have bad teeth, that directly equates to like how much money you have, right? Or what your personality is like, right? Or what you like to do for fun, right? You're kind of labeled as not very social, antisocial.
Okay.
You want to stay home, watch movies, right? I like to watch movies too, right?
Yeah.
But I want you to be smiling.
And and we were talking about this at the break that it's like the movies. Mm-hmm. They always portray the villain with great teeth, or the person that is a street person or homeless with really bad teeth. In fact, you were saying there's dentists in LA that make bad clip-on teeth for the actors.
Oh yeah.
And so there's a negative association with bad teeth.
Yes, very negative association with it.
And you say they come in, they're embarrassed. Like, doc, this is the worst you've ever seen.
Yeah, it's like they're right now because of COVID, right? They're wearing a mask. But like, hey doc, I need you to take a peek at my teeth, right? I was like, well, first I need you to lower the mask so I can see how I can help you, right? But people don't even want to show me. So the challenging part is, you just want people to understand, like, listen, this is not my first time seeing this, right? I've seen this 1,000 times, and your case, there's hundreds of
It's just these people never smile, so you don't see it.
They just don't see it. Yep.
You don't see it on the street.
Yep.
Okay, you have more photos.
Yeah.
I don't want to rush you, but we're low on time.
Yeah. So here is one more here. This guy's a really nice guy. So we're looking at that picture. This gentleman, he came into the practice.
Okay.
We had seen him actually about 5 or 6 years ago, right? And we offered dental implants at the time, right? But his previous dentist was telling him he always needed a denture. But we have several broken teeth, several missing teeth. He's just not wanting a denture, right? He
So
wants
he comes
a full
in,
mouth. Yep.
And you told him so 5 years ago.
Yep. We never tell him that we're right, right? But he came in, I think it was 10 days later, we gave him a set of permanent teeth on the top. Yeah. Here is an after. Wouldn't you say he looks a little bit more like sophisticated?
He does.
Doesn't he?
More handsome.
He's very handsome. Yeah. But just big smile again. You can see it in the cheekbones.
So those teeth are, they're supported by implants.
Correct.
They don't come in and out.
Nope. I don't know what this guy's going to eat, but he can eat whatever he'd like.
Nice.
I have one more to show you.
Okay.
So this is a case that our office did. I wanted to show you because this is an amazing transformation. She is very popular in our office because of her smile.
Okay.
So several fractured teeth, right? Missing teeth, bleeding gums as well. And she needed an option. We had several options, and for her, she chose to do permanent teeth with implants. And as little as one afternoon, we got her scheduled to get her permanent teeth. Here is an after picture.
Big difference.
Big difference.
Dr. Dune, your partner did
Yeah,
this
he
one.
actually did this one. Yep. Doesn't she look content now? Does she look happy?
He looks better.
Yeah, she looks a lot better.
A lot younger.
She does. Her hair's done. You can actually you can even see her eyes a little bit more, right? Her eyes are matching her shirt. This big smile. She's very happy.
So people are back to like salads. Could they eat like nuts, like almonds, things like that?
So most common ones we hear is, Doc, I want to eat almonds, right? Or pistachios, or I miss salads, cucumbers, vegetables with that good crunch.
So if a patient goes to you, and we're just about out of time, what are the options if a denture wearer comes in or somebody that needs a full mouth of extractions and new teeth supported by implants? What are the options?
Good question. So we have an upper denture and a lower denture. Our next option would be to connect the denture with 2 implants, 2 to 3 implants, especially on the bottom. Nobody likes the lower denture.
So like a snap in, snap out.
So the teeth will actually snap in and snap out. I put 2 or 3 implants in, the teeth snap in. Right? Another option is for the top. No one likes the roof of the mouth covered, right? You can't feel what you're eating. You're putting all this, this glue, right? We'll call it. It's actually glue on the roof of your mouth, and you can't taste food. So what we do is we put a minimum of 4 implants in on the top, and then we can do a set of snap-in teeth for the top.
Okay.
Right. Our next option is doing a permanent set of teeth, right?
They don't come out.
They do not come out for the top and the bottom. At that point, I place usually a minimum of 6 to 8 implants.
Okay.
I always place more than 4, right, when there is more bone. Not everyone is built the same, right? Our Harley Davidson, the motorcycle driver, is not going to be, is going to be needs more implants than, our more sophisticated older woman who reads books at home, right?
Okay.
Yeah.
So bigger the person, bigger the bite force, you just have to make it stronger.
Yes, you need to over-engineer these things, right? So it's tailor-fitted for every single person. So when we bring someone in, we make an estimate. We see you need this many implants. This is where we're going to put them. But you get permanent teeth, right? So back to that portion. So we can give you permanent teeth on the top and permanent teeth on the bottom. The only time that they come out is if I unscrew them for you. Okay. Only reason I would do that is if we're not cleaning well at home.
All right. So they come in like every 6 months or every year or whatever for regular cleanings.
Yeah, just like you
back.
had. Yeah, you're back to where you normally were. So I always like to gauge it on a tier. So with a denture, it gets you about 10% of like what you would normally have if you had all your teeth. The snap-in teeth gets you to about 70% of what your normal chewing could be. But when you do the permanent set of teeth that does not come out with zirconia, that brings you to 90% of you having all of your teeth. So you're right, it is. You're getting
you can just
back
eat whatever you want.
Eat whatever you'd like to. Correct.
We're out of time. Final message, somebody watching this. Maybe they've heard everything you have to say. They either are currently wearing a denture or they're headed to a denture.
Yeah.
But let's say they're afraid still.
Yeah.
And maybe they're just don't want to go to the dentist. What do you say to them?
A smile is contagious, right?
Okay.
A smile can tell words in a story, right? A smile can tell a story that words just can't.
Okay.
Right? People who smile great, they want people. They instill confidence in others. People want to be around them, right? Life's too short to not smile. I want you to eat what you want to eat, whenever you want to eat it. I want you smiling. It's just an increased quality of life, right? So please come in. The biggest takeaway is that if you don't know what your options are, you need to figure out what your options are, right?
Good.
Just come down, sit with me. We're going to talk just like you and I are talking right now, and you're going to come up with a game plan.
Okay, good. Now, we should mention, because you train other dentists, does it cost more to go to a guy that teaches other dentists? It's a training facility. Tell me about that.
It actually doesn't. So because I own the lab, right? Our practice, we do everything in-house as a group, right?
Okay.
It's actually less expensive at our office.
Now, we have to mention this because we get questions about this.
Yeah.
Medicare does not cover this. Medicaid doesn't cover this. Even the best dental insurance only covers like a tiny, tiny bit of it.
Yeah.
And you say what?
We have a ton of different options to get the job done, right?
Okay.
So we have almost 5 options now to pick from. You can finance this now. All right.
Okay.
So we can always find a way to fit it within your budget.
Okay. You have to have decent credit because it's not like you're carrying it yourself. Is that correct?
It depends. There's multiple different tiers for things. Some things are based on credit. Some is based on if you have a bank account. Other things are financed through other options as well, as low as a credit score of, I think it's 550, right?
So to be able to do this.
This is very possible.
Okay, good. Well, yeah, I want to thank you for coming on the program, and always a pleasure. And if they want to see more of this, they can go on your website. You got lots of photos, video testimonials.
Yeah, actually, just give me a call so we can do it in person.
All right, thanks.
Yeah.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.